Good morning all. I am Dr. PJ Madam Rafi. Today we are going to discuss about GERD and its treatment. Okay. So first of all, what is GERD? GERD means it is a gastroesophageal reflux disease. Okay. Why it is happen means acid in the stomach reaches the esophagus. That means refluxing of acid to the esophagus will cause mucosal inflammation. Okay. Due to this mucosal inflammation and irritation, GERD will be developed. Okay. How do you manage this thing? Obviously, by decreasing acid secretion by using proton pump inhibitors. Next is enhancing gastric motility. By enhancing gastric motility, obviously acid will be moved into the intestine, thereby irritation will get. There will be no chance of reflux. So we can use prokinetic drugs. Okay. So this PPA is already discussed in the peptic ulcer class. So we are not going to discuss here. So we will here discuss only prokinetic drugs. Okay. So normally before discussing prokinetics, acetylcholine is the main neurotransmitter in the gastrointestinal tract. Okay. So drugs which are increasing acetylcholine in the GIT will be beneficial and which will be acting as a prokinetic. Okay. So those drugs, what are those drugs means 5-HT4 agonist and the D2 and 5-H3 antagonist drugs. These drugs will have prokinetic property because these drugs will enhance acetylcholine, thereby obviously it will cause GI motility. So thereby it will be showing prokinetic property. So what are the actions of prokinetic drug? Okay, first thing is stimulation of GIT. Okay, that is gastrointestinal tract motility. That means they increase the motility of GIT. Next, increase the lower esophageal sphincter pressure. So that means increasing lower esophageal sphincter pressure means lower esophageal sphincter pressure will get increased. There will be no chance of refluxing of acid into the esophagus. Next is speed up of gastric emptying. Obviously, it will cause more motility of gastric contents into the intestine part. Next, speed up of small intestinal and colonic transit. Okay. So these are the actions of prokinetic drugs. So we will see the drug in the following slide. Next. So first drug is metoclopramide. Okay, it is a 5-HT4 agonist and 5-H3 antagonist activity. It enhances gastroparesis, that means motility will increase, and it will have anti-emetic property. Why means increasing of lower esophageal sphincter pressure. Thereby it will have showing anti-emetic property, and one more thing is 5-H3 antagonist. So obviously anti-emetic property will be there. Okay. Next will be main thing is these drugs will have central, they will cause blood-brain barrier. So obviously they will have central as well as peripheral D2, that is dopamine blocking action. Okay. Due to this central and peripheral dopamine blocking action, they will have more side effects, that is serious side effect EPS, extrapyramidal symptoms. Okay. And hyperprolactinemia because dopamine blocking, obviously dopamine blocking leads to cause more prolactin, hyperprolactinemia. Due to this EPS and hyperprolactinemia, we will not use metoclopramide. Okay, metoclopramide. Next is domperidone. Okay, domperidone will be D2 receptor antagonist, but it will be acting only peripherally. Okay, there is no chance of crossing blood-brain barrier, so it will be safe. It will be most commonly used drug. That's why if you see in Pandy, Randy, Rantac D, all those things will use domperidone. This is the drug. Okay, it will having only peripheral dopamine receptor antagonist. It will not have blood-brain barrier activity. It doesn't cause BBB. Obviously, there is no crossing of blood-brain barrier. So obviously, there will be no chance of developing EPS, extrapyramidal symptoms. Okay. Next group will be 5-HT4 agonist. 5-HT4 agonist will have drugs like cicapride, mosapride, tigaceride. Among these three, mosapride only we are using. Rest of two are withdrawn from the market due to its side effects. Okay, you have to remember the side effects because they have the chance for asking questions. Cicapride will cause QT prolongation, so it is withdrawn. Tigaceride will be having chance of MI and stroke. That's why also it is withdrawn. Okay. Next is other groups drugs which will having prokinetic property, that is macrolide. This is an MCQ. Okay. Macrolide group drugs like erythromycin, they will have prokinetic property. Okay. Next recently developed molecule, that is loxyglumide. It is a CCK1 receptor antagonist. It will also having a prokinetic property. Okay. This is regarding prokinetics. Okay. That's all. Thank you.